6 years since the pandemic, the UK is still paying the price for tackling COVID-19 and the fraud that came with the unprecedented government spending to prop up the NHS and the economy. The COVID Counter-Fraud Commissioner, a man called Tom Hayhoe, who ran an NHS trust during the pandemic, has found that £10.9 billion is estimated to have been lost to fraud and error in business support schemes, including furlough, in which the state paid many people's wages, business bounce-back loans and direct grants that in total cost more than £200 billion. Now, of that £10.9 billion, around £1.8 billion has been recovered, but he concludes the state will never get the rest back. Tom Hayhoe says that as the government rushed to tackle the pandemic, most organisations were unprepared for a crisis that required spending on such a scale and with such urgency, and that prioritising speed resulted in a high level of fraud risk. Now, we'd already identified fraud of £1.8 billion in PPE schemes, around £400 million of which has been recovered to date. But this account is a reminder of the enormous spending on COVID, more than £370 billion, and some of the costly, flawed decisions made in haste under political pressure in that public health emergency. Now, Tom Hayhoe makes 9 recommendations for government, most of them concerned with improving departmental operations, information sharing and making fraud risk a higher priority, and that includes appointing what he calls a challenge champion, someone whose job will be to ask difficult questions in future crises about the risk of fraud. Now, the risk was pointed out at the time these business support schemes were launched, and the Treasury actually was relieved that schemes like furlough worked as well as they did. And if we think back to the pandemic and the almost daily escalation of the state response as the death toll from COVID mounted, it will be quite the job in a future pandemic to be the one saying, hold on a minute.